Footnote number 71. The homeopathic physician who does not entertain the foregone conclusions devised by the ordinary school, who have fixed upon a few names of such fevers, besides which mightly nature dare not produce any others, so as to admit of their treating these diseases according to some fixed method, does not acknowledge the names gall fevers, bilious fever, typhus fever, putrid fever, nervous fever, or mucous fever, but treats them each according to their several peculiarities. Explanation of footnote number 71. The homeopathic physician does not give importance to the previous conclusions formulated by the ordinary school, allopathy, who has given the different names. For example, gall fever, bilious fever, typhus fever, putrid fever, nervous fever, mucous fever, etc. etc. This old school has given so many names that nature will not dare to produce any other type of fever. This old school was treating such diseases, fevers, by some fixed method. Homeopathic physician will not accept such different names of fever, diseases, but will treat them according to their several peculiarities. Footnote number 72. Subsequently to the year 1801, a kind of Purpura miliaris rudhong, which came from the west, was by physician confounded with the scarlet fever, notwithstanding that they exhibited totally different symptoms, that the latter found its prophylactic and curative remedy in belladonna, the former in aconite, and that the former was generally merely sporadic, while the latter was invariably epidemic. Of late years, it seems as if the two occasionally joined to form an eruptive fever of peculiar kind, for which neither the one nor yet the other remedy alone will be found to be exactly homeopathic. Explanation of footnotes number 72. In the year 1801, a kind of Purpura miliaris, which came from west, here physicians got confused with the scarlet fever, even though they were exhibited totally different symptoms. Scarlet fever found its prophylactic and curative remedy in belladonna, while purpura found its remedy in aconite. Purpura was sporadic generally, while the scarlet fever was invariably epidemic. If these two diseases, scarlet fever and purpura, joined occasionally to form an eruptive fever of peculiar kind, for which neither belladonna nor aconite will be found to be exactly homeopathic.